So next bacteria we will talk about is Legionella. It is one of the most recent diseases described recently in some last 50 years, and bacteria belong to family of Legionella, genus Legionella, and actually we have about 50 different species described, and they're classified into 71 serotypes. The main representative of the genus is Legionella pneumophila, and it is responsible for main number of diseases. But it's difficult to give you some good data, because actually identification of disease is difficult in routine laboratories because of several reasons, and some international data is very poor because usually diseases underdiagnosed. So in gram stain, bacteria will appear as red, means gram negative. It's stained poorly, but it can have very large size and is easily identified in the microscope. Bacteria is pleomorphic, it means it can vary in shape significantly. Some bacterial cells can appear as a cocobacilli, almost a coccus, while other will occur as filaments with very huge length, and they can overlay one each other and occur as the one scratch on the slider like that. So usually bacteria is described as a slightly curved rod-shaped bacteria, but again, as you can see in the center of the slide at microscope view, shape and size can be differ significantly. Bacteria is motile bipolar flagella, but as you can see in that electron photo in the right part of the slide, some cells can have subpolar location of that organ of motility, and it's going not from the middle of the cell, it's looking like a continuation of the back cell wall. Bacteria is non-sporing, non-capsulated, require oxygen for respiration, and again fastidious for cultural properties. In clinical samples, bacteria very often occur as intracellular parasite, but that property is not obligate, and microbes still can be cultivated in cell-free culture medium. So, very first description of Legionella is dated with 1976 year. It was in USA in some conference of American Legion, and disease occurred as an epidemic among presenting people, and because of that legion, disease was known or was named as a Legionnaire's disease, and microbe was provided with the name of Legionella. So usually Legionella causing respiratory diseases manifest as a severe bronchopneumonia, and again all cases described they usually occurred in small epidemics in some collectives. Most frequently affected people are above 55 or 60 years of age, and usually it is male person. But again, data is limited because of poor diagnosis, and actually we have no standard methods even within countries to confirm the disease, and usually the disease is underdiagnosed, and usual diagnosis of pneumonia is given for those people without proper identification. So data is very poor, and disease is poorly studied still. It's not very prevalent as we think, but maybe it is our mistake. Besides classic manifestation in the case of pneumonia, we have mild disease, which is known as a Pontiac fever. It was described previously, but disease occurred as a flu, common flu. It is a mild disease with some low-grade fever, respiratory symptoms, and it is self-limited disease. In 2 to 4 days, spontaneous convalescence will appear, and usually those people not require any medical attention, and they will not look for medical help, and disease will not be diagnosed properly, or will be identified as some respiratory, viral even disease or other bacterial disease without confirmation of etiology. And again, several cases of extra pulmonary, extra respiratory manifestations were described, but it's not possible to accumulate some proper data because of very rare incidence of that disease. To cultivate bacteria, we need specific culture medium, which is known as BCYE agar or buffered charcoal yeast extract agar. As I think, Legionella is the most beautiful bacteria if we talk about morphological properties. In the UV light, bacteria have a property of self-luminescence, and colonies appeared, or bacterial growth appeared as very intense bluish glowing light, as you can see on that lower left part of the slide. And actually colonies of the same species can vary in color. They can be pink, blue, yellowish, or colorless, and it's not meaning that it is not a pure culture, it's just a property of microbe. And colonies can have different structure. It can be entire and glycerine, or looking like some even growing of fungi or cotton. So in culture medium, microbe is really looking beautiful, and it is possible to identify it even by cultural properties. But again, agar is very specific for that bacteria only, and in routine laboratories that culture medium is not available. So we have just no option to cultivate that microorganism in proper manner, and usually the disease will not be diagnosed as a Legionella. Again, bacteria is poorly studied, and we have no full information. It is confirmed that bacteria is able to multiply within human cells and hide from macrophages and other immune factors of human body. They have number of proteolytic and lipolytic enzymes which can damage our antibodies and our tissues. And bacteria have secrete major protein which have confirmed hemolytic and cytotoxic activity, but mode of action is not described and not studied, and structure of toxin is as well studied poorly. If you talk about pathogenesis of the disease, it's kind of similar. Bacteria is transmitted by respiratory way. Usually it is droplets of aerosol, and actually Legionella is aquatic bacteria identified in water of different reservoirs, natural or even artificial. And after inhalation of microbe, bacteria will be engulfed by alveolar macrophages, but again it can survive inside those cells. It can inhibit fusion of phagosome containing pathogenic engulfed bacteria with lysosome which contains lytic enzymes. And bacteria cannot be digested by enzymes, it just will remain in that phagosome within macrophages. Here it will multiply and increase in number until some space available within the cell. When Legionella will occupy the whole host cell, it will rupture and bacteria will be released. And of course, other phagocytic cells will recognize pathogenic microbe, will engulf it, and that cycle of multiplication occurs again and again until all surrounding cells will not be damaged, destroyed, and bacteria will multiply. So the only source of bacteria identified till nowadays is environmental water. Usually it is some tub bath or swimming pools, some natural aquatic reserves with hot water. It required hot and clear water. So recently few cases of disease transmitted through shower aerosols were described, but again it was some aquatic water delivered for washing for people in some hotels. Risk factor again is age over 55 years of age, and it is looking like disease is more frequently observed and occurs more severely in people who smoke and have some concomitant diseases such as diabetes mellitus or bronchitis or emphysema or some other. But again, number of cases is not very high, and it's not possible really to identify some precise risk factors. So any type of aerosol can act as a source of Legionella. It can be very small invisible droplets such as some air conditioning system, or it can be visible like a fog when hot tub is used or shower or some other sources. And no cases of transmission from one human to other human were described till the moment, but because of low number of publications and low number of available data, it's not possible to estimate that it is really so. Maybe can be transmitted, but till nowadays no cases were described. Incubation period is usually about a week, can last up to 10 days, and disease will manifest with some muscle aches, slight headache, rundown feeling, and actually symptoms are not very unique for disease. And in several days after that, very fast subject will have appearance of dry cough, extremely high fever with chills, myalgia, chest pain. Maybe disease will have some concomitant symptoms with GIT infection, abdominal pain, vomiting, and in rare cases watery diarrhea was described. Of course, disease initially looking like common pneumonia, and any doctor to confirm or to exclude pneumonia will prescribe X-ray examination for those patients. And most frequently diseases manifest with formation of abscess looking like a cavities, empty cavities on X-ray. Very often and almost always both lungs are affected, and this is acute as double-sided pneumonia. And without proper treatment, without proper management, it can progress to multiple lobe problems, and all 5 lobes can form a consolidate. They will be damaged together. The whole lung will be damaged. Main reason of lethal outcomes is acute renal failure or dysfunction of liver. Disease can manifest with some damage of central neural tissues. People can be some kind of depressed, suppressed, lost orientation in time and place. They cannot some recognize other people, and mortality rate can be so high as 30%, but depends on concomitant diseases, concomitant pathology, and age of the people. As you can see on those examples of X-rays, disease mainly starts with lower lobes, but it is intense infiltration and white patches from the middle of the chest cavity to edges. The whole lungs can be involved, and it can be not symmetrical manifestation. One lung can be affected higher than another one. And of course, the disease required antimicrobial treatment. Usually, macrolides of fluoroquinolones are administered alone, or maybe in combination with some rifampin or other drugs. For prevention of the disease, again, we don't have any specific measures. No vaccines are available, and actually, we don't know properly what to do with those people and how to prevent the disease, because multiple serotypes are described, and disease is rare in common frequency. But common measures of purification of water, such as filtration or addition of chlorine solution or some other methods, such as overheating of the water, can prevent the disease. And usually area which is kind of endemic by Legionella, people are acknowledged, and a lot of posters are applied near the bathrooms or near some public places with water, like that's shown on the slide. How to prevent the disease, what to do, and how you can be infected, how to recognize that it is some not regular respiratory disease, what to do, where to go to look for help. And again, some risk factors are given here, and information how to avoid disease, or if you're already infected, what to do, where to come. So non-specific prevention is the main measure to prevent the disease, but usually people are acknowledged poorly, and even doctors are poor knowledge about the disease, and again diagnosis is very frequently is done not in specific manner. It means that disease is not diagnosed as Legionnaire's disease. Usual diagnosis of pneumonia is provided, but maybe now you will know that it is so unique bacteria present here, and you will perform proper diagnosis of the disease in your future professions.